Hey guys, I'm back. We're doing part 2 of the pec repair video series. This one's called Sling Life, and I'm going to talk about kind of right as I woke up from surgery, moving into the next stage of the injury. So I was in a sling for 5.5 weeks. The sling was pretty extensive. It has a body strap that goes around your midsection, and then it has this block here so that it keeps your elbow kind of away. It's got a squeeze ball and then actually also a thumb thing to really keep your elbow situated in the corner of the sling. So waking up from surgery, I think the surgery took about 1.5 hours to do. I had steri strips over the top of my incision, which is, they did a very good job with my incision. Right now it was way more red when I came out. I forgot to mention last video, I'm 20 weeks post-op right now, so my arm's way larger than it was. I'll get into that later on in the video, but my scar's actually gotten more pink and more flesh colored, so it's definitely healing up. So it will look different than this when you're finishing up the surgery. So here's a closer look at my incision. It's kind of got a little bit of a bigger bump down there. You can see I strained it and actually kind of tore it open just a little bit more, but it heals down. Basically, once your stitches dissolve, you can they'll tell you right after you get out of the sling, they'll start to work your scar with your finger. Another thing I did is I waited for the doctor to okay it, but I started putting, this is a vitamin E capsule, just 100% vitamin E inside of a gelatin deal, and I would nick the end of it with a knife and then kind of just paint the scar with it and then just kind of massage it in. But I'll talk about that next video. That's more next video stuff. It was when I got out of the sling. But I thought they did a really good job with this incision. I was instructed leaving the hospital to not get this very wet, especially submerged, because basically it's still an open wound. They have internal stitches, so I had a bunch of internal stitches and they basically just steri stripped over the top of it. And it's raised up. The stitch is dissolved. Right now it's dropped, but when you get it right out of the gate, it's pretty raised up like a bump. I got prescriptions for narcotics leaving the hospital. 5 milligrams oxycodone. They also gave me this drug called ketorolac. That's the actual name. The brand name is Toradol, something like that. It's a heavy-duty anti-inflammatory, so it's prescription anti-inflammatory, and I took that just for the recommended time, and then I actually was off narcotics as far as oxycodone in 1.5 days, 2 days. The pain isn't so bad, just kind of more of a throb. I kept it very low key for the first 2, 3, 4 days. I didn't even really walk around that much. A lot of it was spent in a bed. So leaving the hospital, you definitely want somebody to kind of take care of you because you're very fragile, and it's a serious trauma to your body. Anyway, I also supplemented. So the time I was taking those drugs, they also wanted me to take a lot of vitamin C. There's evidence, apparently, I haven't really looked into it, but there's evidence that vitamin C actually helps the tendon healing process. Because they've just set that tendon right on the bone, as we talked about before. So I took their vitamin C, and then on top of that I took a multivitamin called Green Source. It's just one of those ones without food coloring or sodium lauryl sulfate or anything like that. So I just took, you can find them at health food store, you probably don't have to use that one at all. Then I also took what's called colostrum. I'm not sure if you guys are familiar with that, but it's 500 milligrams, so 60 capsules. And the serving size is 1 capsule here, and basically it's the milk they get 48 to 72 hours after a calf has been born from a cow, and probably doesn't work, but I just figured it's not going to hurt me, so I supplemented with that too. It's also supposed to help tendon healing and stuff like that. I did actually find some studies on that. Who knows if it is valid or anything, but I want to tell you guys everything I did. The other thing is, exercise-wise, so you immediately have to stop moving your arm, basically. Coming out of, for the first 2-3 weeks, I started to see atrophy. I noticed heavy atrophy in 3 weeks as I was going to feel my shoulder. Instead of the rounded portion on your deltoid, which is this, shoulder cap muscle right here, it kind of would go to a corner and then shelf off like a slant on it. So I knew I was losing muscle. I could feel it in my upper back. I was kind of protecting. I did a lot of protecting with my trapezius muscle. So I kind of lifted my shoulder and I even out of the sling, after I got out of the sling 5.5 weeks later, I walked around like with my shoulder way up, and that took a long time to get my gait back to normal. The sling is the worst part of the whole process. I'm 20 weeks right now, and by far it's been the worst. Dressing yourself is very difficult. I couldn't tie my shoes. I'm right-handed, so everything had to be done left-handed. My notes in school, my senior year in college, I'm having to kind of type one-handed, and it was tough. It's very, very tough. Showers also, where I pretty much had to try to keep it dry. You can get it a little bit wet, but I mean, I'm trying to do all of my shower duties with one hand. Some people will keep a block in there, like they'll put a 2-liter soda in there and pinch. I didn't. I just I grabbed my own stomach skin actually after I was out of the sling. So if you imagine this is my injured arm, I just made my own sling by grabbing my chest. I took my shirt off for this video, partly so you could see the incision, but also to show you what the sling looks like, because this is how I put it on. I really didn't put shirts on because it was so much of a hassle. When I was home, I basically just had the sling on like this. Also, another kind of gritty detail of it is it starts to smell bad, and they shaved my armpit for the surgery as well, and it was hard to make myself not stink, really, to tell you the truth, because it's a very delicate area and stuff like that. So just kind of more misfortunes in the sling, if you will. One of the other things I want to talk about is the exercises they had me doing. So immediately out of the gates, I started squeezing on this ball here, and I started there until this was easy, or I found that I couldn't really get a good burn in my forearm. I moved over to a hand clamp, just a really basic one like that, and I'd take off the thumb strap and I would just kind of sit in here. This doesn't use any pec, it's just something you can do to, if you're bored. You're going to spend a lot of downtime, so I kind of just kept this forearm strong. Cardio-wise, I wasn't instructed to do cardio. They didn't tell me not to, so I took it easy for the first 3-4 days, and then I got into a recumbent bike and did some pedaling. Really light pedaling. If you don't want to be thrashing around, definitely no running, and you'll know, you can feel that it's definitely like straining the repair. So when I was doing the recumbent bike, which is actually pretty interesting to me, one of my theories that to heal something with a poor blood supply, like a tendon, the white tissue on a tendon, my theory is that if you increase your heart rate, you're pumping more blood to the injury because your heart rate's increasing. You're going through that exercise process. And so what I did notice is I was on this recumbent bike maybe 3 days after surgery, 4 days after surgery, and after I was done, I'd kind of pick it up towards the end and really throw that heart rate as high as I could. I'd look down, and through my steri strips there was blood coming out of the incision. So I knew that I was pushing extra blood and pushing up from under the incision. So it was kind of a good sign for me, even though it looks like I got this band-aid over the top and it's like this red blood spot. But that was my intention with the exercise. One of the other things is I experienced some pretty serious depression. I constantly, for the last 8 years before the injury, had been doing pretty much every day high intensity cardiorespiratory exercise. I was wrestling, doing jiu-jitsu, doing MMA, running, doing hard workouts at the rec center at Washington State. And so I've had to stop doing all of that, and it really took a toll. Maybe the first 2 weeks were okay, and then it kind of really starts to drag on you, like, wow, I haven't worked out in a long time, and you start to notice you'll lose your shape. But it's just something you have to get through. There's services for all sorts of stuff like that. I actually went and saw somebody and just talked to him once a week about what was going on with my mental state, just because I wanted to protect it so much. Basically, like, the way I tried to describe it to him is that my medicine had got taken away, is what I used to keep myself mentally healthy. And then the very last thing that I'm going to go over today is the fact that I got, as the atrophy was happening, I got some elbow pain. So I think probably from the fact that I wasn't doing any of this flexion, extension, no motion at all in the elbow, and a lot of the weight was kind of, the forces are just kind of directed towards the elbow there, and you're not using it. It would slip sometimes down this way, and then I'd move it up, and the fact that it has so much inactivity, I think it started to swell up, and basically your joints, if you don't move them, will harden up. You'll lose range of motion and stuff like that. And so I'll see you guys next time. We'll talk about getting out of the sling and the exercises I did to build myself back up to where I am now.